before I get on with the questions, I'd like to introduce the group, and I'll start with Troels sitting there. Troels, you have already introduced yourself as being a clinical neurophysiologist and a professor at the University of Copenhagen too, and you have written an amount of different books with how you can actually work with your training and improve your brain, the plasticity as you talked about, right? And I have to see you are Sophie. So you are Sophie, and you are working in the Danish Scleroseforening, the association, MS Association of Denmark. And I think I found very interesting that you've been working there now for 2.5 years, and you're working also in a project developing some digital tools for addressing also some of the cognitive issues with people with MS. Is that correct? Yeah. And we have sitting. Yeah, that's Raisa. Yeah, and Raisa, you are representing an MS society also from Latvia. Yeah, and you are actually living with MS yourself, so you are having that perspective into discussion. You're working as a journalist and also a newscaster, and you have also devoted a lot of your life to the study of art. And then you're a loving mom and wife. So that's important to get all these aspects. And then we have Hannah sitting there. Hannah Lind, you are also a person living with MS for seven years, yes. And you have started a Swedish podcast called MS-tautin. How do you pronounce that?
MS-tautin.
MS-tautin, yeah. Last year in March, and actually it's become a very great success. I must say it's been downloaded 50,000 times. So you seem to be representing a lot of people living with MS. I assume also young people, more or less newly diagnosed, which is a group that's very important to have focus on. And then we have Cecilia Smith Simonsen, yeah. And you are a neurologist working in since 2010, and you are actually working in Oslo, yes. And you are working very much with disease development and progression of MS, special interest in MS. Is that correct?
Yes.
Yeah.
That's right.
And finally, we have Jan Holmberg, who's Master of Healthcare and also award-winning expert in the field of national and international development projects of healthcare, and a member of the board of the Finnish MS Nurses Organization. So you are representing the nurses in this board and being very progressive in developing the field, I must say. I think we'll actually get on with the questions and start from where we more or less left this morning. And so I'll start by addressing a question to you, Cecilia.
All right.
Because earlier today we heard about this brain health and quality of life and the connections between these two and how we work with that in the clinic. And I would like to ask you, from your perspective as a doctor, what are the typical symptoms that you meet with people with MS related to brain health and your experience with that in the clinical practice?
All right. Well, a lot of my time, of course, is focused on MRIs and the clinical examinations, etc. And we do talk about attacks and relapses, but I think maybe the most common symptom is fatigue. I would say about 80% of my patients will complain about fatigue at some level. And cognitive difficulties, concentration difficulties, memory loss, not outright dementia, certainly not, but most patients, I would say more than half, have some degree of concentration problems. Just coping skills with everyday life, how to deal with multiple sclerosis.
Yeah.
Yeah.
So there's actually the fatigue and the cognitive issues that fill up a lot of
quite a lot of time.
Concern with
Absolutely.
People with MS. More invisible symptoms, you might say.
And also maybe the ones that are hardest to treat. notoriously difficult to treat.
They are notoriously difficult to treat because they also have the implication of course, the neuropathology of the MS, but also the psychological and the other
Absolutely.
empowerment, sort of self-efficacy, self-determination factors involved in them.
Absolutely. And what came first? You know,
What
are they
came first,
fatigued and
And
cognitive
they probably are there
difficulties?
together, right?
Absolutely.
So that could bring me to the next question, because how can we then get out of this, help people get out of this vicious circle, because it is sometimes a vicious circle also. I've talked something about it in my presentation of the community aspect and worthiness and things like that. But you, Troels, you were talking about the plasticity, and you also talked about how you can actually train your brain. So we're talking about a vicious spiral and the fatigue, and how can we help these people? Because MS negatively affects the brain. How can we get them out of this vicious circle?
Sometimes I talk about it in a very simple way. The good plasticity and the bad plasticity. Mm-hmm. Basically meaning that if you go out of your comfort zone, you do something that you are not really comfortable with doing, and become better at it, that's increasing the good plasticity. If you instead focus on things that you're unable to do, like fixing the gate that we heard about before the break, then you endorse the bad plasticity, or you sort of the vicious circle. So what I think is really important here is that we help people to get successes, to realize that they can actually get a little further than they did before. And then, of course, I'm fully aware there is a lot of hardware not working, and you cannot fix the hardware just by training or just by being aware of plasticity. But I think that's an important issue.
That's an important issue, to actually have some basic knowledge about what's going on in the brain, so that you don't have to be afraid that if you get a little bit tired, are you then getting things worse? You mentioned that to me in the break, that you can go to the limit of what your capacity, and then you go back and restitute, and then you'll be fine. It'll not worsen your disease. So there's some information to be given there.
I've done quite a bit of research on concussion for the last year, and there have been many reports out that while we used to recommend people after a concussion to go and hide, and dark room, no sounds, no interaction, just wait until it disappears. Over the last 5 to 10 years, this has changed, and the plasticity view that go to the edge, get out of your comfort zone. If you can empty the dishwasher, do it, and then go back to bed. And I think that's important to remember in all aspects of life, not only concussions.
Yeah. So there's an important role to be done there in informing about plasticity, and also what you talked about in how you train your brain, and how much errors you can actually accept without getting devastated. So how can we use that, Cecilia, in working as doctors? Do we see them every 6 months or every year? What could our role be in that? What do you say about that? As doctors?
As doctors, multidisciplinary teams are quite important. And I think in Norway we don't have enough psychiatrists, psychologists to help us along the way, because behavioral therapy, cognitive behavioral therapy would be very important for these patients. You know, how to, as someone was saying earlier, you know, at some point you just need to accept that this is life, and then you have to work with what you've got. And I wish we were better at that, but we have restriction for time. So being able to kind of build or work with other specialties to help them as well. I
guess we have this limited time, so so maybe our role could be that we talk about the neurological part that you're talking about. That piece of information could be valuable, and of course talk to our nurses in the clinic. How can we then support each other in the piece of the information that we're giving? And
absolutely,
because this is a big issue, of course, the invisible issues of MS, whether it also could be that you have bladder issues that could be socially very embarrassing and impairing, but the things that people can't understand, the fatigue and because it's difficult people to understand it, even for the individual with MS, because maybe the next day the fatigue is not there. And what I've been told is that when it's not there, you forgot that it was there yesterday. It seems as if it weren't there. Is that something that Reisa, you represent a lot of people with MS from the Baltic area?
Yes.
Is this issues that you meet a lot and something that you talked a lot about?
We have meetings in association, and we speak about our problems, about our symptoms, and more people told that they feel something new, and we speak about these new symptoms and how we can try to live, and maybe if we know a new advices, how we can live with this. We talk. And of course, now we have internet and we have a Facebook page, and more people write not about doctors or some medicals. They write about our lives and how they feel, and cry and told that oh, maybe you know how I can live. and we ask. Yes.
Yeah. So it's a forum where people, they can actually talk about how they feel. And I know also from my friends with MS and also on the boat that it's very, very healing for them that they are in a community where people intuitively understand how it's, what it's like to have this disease.
Yes, of course, and the patient needs psychological help, of course.
Yeah, because when now we have this title, The World versus MS, so that how can we actually address that so that you don't feel that you are just here in the group, maybe myself or this group, and then there is the rest of the world. How can we, what do you do in Latvia, for example, this question about the relationship to the healthcare personnel, and what kind of responsibility could you actually take in that, in changing that culture, if that's the aim?
I think we need more speak about MS with other people, and told that we are normal people, but we have MS.
Yes, good
but
point.
It's not a shame. More normal people think, oh, MS, it's the shame. It's like a HIV. I told these people, they think I'm a crazy person, but I'm a normal. And more people with MS are normal too.
But, I'm sometimes crazy. Yes, but that's important issue, because it's also something that I hear that it's the information about what it's like and talking about it freely, because you also receive a lot of projections from other people, their picture of having MS, and also you meet your own picture of MS inside in the pictures of others, even though that's not their intention. Do you follow my point?
People need to show a normal example.
Yeah.
Not only old people have MS, young people have too. And young people have families and have futures, dreams, and they can...
We're normal people. That was also one of my points in my presentation, that I think that could be a very good starting point, that we could actually then contain the pain that people have, because it's normal to have pain in some way when you're a human being. I'd like to ask you, Hanne, being a young woman living with MS, and nobody can see that you have MS, and I imagine and I hope that you actually live without any major symptoms of this disease. I hope that for you. You don't have to tell me. But of course there is an aspect that you have this disease, you have this sort of error in your immune system that might cause you trouble. So when you go to your doctor or to the clinic, how do you prepare yourself so that, let's say that I can understand you, and so that you can actually get what you want from this appointment?
Yes. Actually, now I am between two doctors, because my old doctors moved to Iceland, unfortunately. But I'm going to talk about him now. But he was always very, humble. And so when we met, we was equal, and he always told me that I learned him about MS. So, and he was always very asking about my life, and of course asking about my disease, but and always showed me my brain, and here's a new plaque, and it makes you feel like this. But you are a doctor as well, but you cannot be our therapist or a working therapist, I think the problem is that it needs to be a bigger team for help us with because you can you're educated to treat at MS. You're not educated to treat them how I feel as a human. But I wish there could be like you always have a checklist for the body, and when you come there, you have to jump on a leg and point to your nose and do all this test. It could be like a small test for your life, and you do it every year, and then you can see, oh, you need to see someone there, or a psychologist, or someone.
So that you say that your doctor moving to Iceland now is very humble in the way that he sees you, that he learns from you, and I've recognized that, and I think that's a good approach, and also that we can't expect that the doctor can take all the positions as both the psychotherapist and the father and the mother and all these roles that are necessary to people that are necessary to have around us. So you're talking about having a broader team of people. What kind of team would you put together if you were to decide?
I would put together someone who work with the body, like a trainer or
physiotherapist.
Yeah, exactly.
And many people with MS, they love yoga. They have benefit from yoga, for example.
Yeah, and then also a therapist or a psychologist who can work with the brain, because it's not your job to do it.
So
and then someone, if you have problem with fatigue or cognition, maybe is what do we call it, arbetsterapeut, working therapist, who can help you with your life and work and everything that's
occupational
happening.
Therapist, you call it in English.
Exactly.
Ergotherapeut in Danish.
So they can work together with you for making.
I totally agree, and that's why I envy. Where's Finn? Did he leave?
I'm a nurse.
And a nurse.
His job as
exactly.
as a nurse, yeah. There are many roles, right? So I know, and one thing I think is important though is that, that we address that in the doctor-patient room too. I know from experience, or believe from experience, that it means a lot to people with MS that I actually have some kind of idea of working with these things. And I am actually a trained psychotherapist too, but it's not that I have to work like that with you. But for instance, in understanding the fatigue, I have experienced that it means a lot to people that I'm a doctor, and being able to talk about fatigue, because sometimes people with MS, they meet a psychologist that doesn't know anything about MS, so you sort of having to be your own expert and sort of train the different kind of people you meet along the way. So you should have it, at least in my opinion, around this specific topic.
And
the MS clinic.
Yes,
Sorry?
and also one small, to all these people, just some meeting, maybe one time in a month, a small group with other people who has MS, because it's so important for you to meet other and
that's what
it makes
Raisa
you
was
feel
talking about. For
yes,
the,
it makes you feel
you can actually
like
just be
you're
yourself
normal.
and be normal, and also in the whole communication between, that's actually tying things together, that we have to help tie, as a healthcare system, tie things together, and that's also what you're working with, Sophia, I imagine, with the digital tools, right? That you can actually communicate, and you can get help with your cognitive issues during the day, of course, too. So now we're talking about the importance of multidisciplinary teams, and which of course brings me to you, Jan, who's a nurse working with MS. So you sometimes have more time and another sort of context to talk to your patients. Do you? How do you feel about that? What do you discuss in these? What kind of room is that, and what issues do you discuss? And I'd also like to ask you, how do you then bring this information on to the other in your team, for instance, the doctor, or do you do that?
Well, actually, I'm working on the mental health services, so I can treat somebody with depression. Somebody can have MS, but the basic list, take-home message is 6 messages that I'm giving to everyone.
Yeah.
After I've been working and talking with people with MS or depression or whatever, And they are keep as active as you can, keep your mind active and let your mind rest enough. The third one, keep your weight under control. That I could take the hint actually as well. Watch how much you drink alcohol and avoid smoking. And fifth is seek early on help for comorbidities like vascular diseases, depression or anxiety. Don't let it go too far and think that this is just all in my head. Our patients are also saying that I am crazy. I don't like that word. I don't think anybody is crazy
You
in
use
the
that
world.
word too, right?
Yeah, I don't like the word. I don't think that anybody is crazy, and it's used as a swear word. And people
That's why that I say that I'm crazy sometimes.
Yeah,
but
yeah. People have mental
normalize
health
it.
illnesses, and that's one thing. And craziness is a swear word.
Yes.
But the sixth one is the most important one. Have mercy on yourself to avoid unnecessary negativity in your life.
Yeah.
Because positivity is the one thing that makes you feel better. It probably doesn't cure you, but it makes you feel much, much more better. And many times, people using our services, they get miserable when they get out of there. Of course, they get bad news, but it's all in the way, how do you bring the bad news to the people? So if we're talking about brain capacity, for example, and our message is that it's decreasing, you're gonna die. It's not a good message for the people who are there with anxiety already. We can say that this tissue can be replaced when you work with your brains and do these and these things and so on. And yes, your second question was, do I talk about these issues with all of the team? Of course we do. Yeah, we share ideas and
So you work in a
tips.
multidisciplinary team?
Yes, yes, of course.
Yeah.
I couldn't work by myself.
No,
It
but
would
you're
be
saying,
impossible.
of course, because the things you were addressing that you talk about, sort of the lifestyle parameters, those are the things that general practitioners, they normally talk to their patients with, of course. So maybe you should have this MS clinic where also we had the general practitioner there. So at least there is a need for tying things together.
But actually, if you work in the somatic field or you work in the psychiatric field, it's not so different. The basic things like being active, using your brains, checking the symptoms, they are all the same. We just tend to find different disciplines. It's in our mind as professionals, not always in the case that we're working with and on the minds of the people who are coming to see us.
Yes, that's true. And also, if you are a person living with MS, and I think that, if you allow me, the things that you're mentioning, the 6 advices, I totally agree. They're very important. But we all know that, don't we? Really? We know it already. And you're also pointing to yourself.
Yeah, that's true. That's true. But
my point is, how can we then help people when they go home? Because if you have a depression, of course, it always look at the bright side of life doesn't really help.
Well, not that exactly, but we have to also talk about dreams and hopes.
Yeah.
We never talk about dreams and hopes of people. But if I take all of your dreams and hopes away just now, what is left of you?
Yeah,
nothing.
Exactly.
We need that. And those dreams and hopes brings the ability to think positively also in your life.
Yeah. So now we've heard from all of you different perspectives, and also some of the same perspectives on how brain health is related to quality of life, and what are the main issues. They are issues like the fatigue and the cognitive impairment that you see, and the psychological aspects of who you feel you are, and if you are an art person or if you're just a normal person who happens to have this premises of life with you, that you have an defect in your immune system that might do something, so that you actually normalize it, and that you have these groups of people meeting up, and that's very important, but also that you can reach out and talk about that and give information about that to the society, so that you can actually talk about it and just be yourself. So those seems to be very important challenges. So I'll ask the whole panel, the 6 of you, did I get the challenges right, and what can we do about it? Do you have some 3 good, quick ones to say? What can we do about it? But I see an issue in tying things together. Do you agree on that? Any comments on that? What can we do? Sophie?
So One thing we are trying to do with this cognitive tool we are trying to develop is that it should be easier to gain information about what you can do in your everyday life to improve or cope with these challenges you can experience.
Yes.
So not only when you're talking with your doctor or your nurse, but also the 12 months or 6 months in between you're seeing the healthcare professional. So make some tools that make it easier for people to find the right information, so they don't have to search worldwide themselves to find it. But what should I eat? How should I train? What kind of strategies should I use in my everyday life to make my life easier?
Yeah. And that's something that Jan and I, we could learn from too. Don't you think, Jan, I'm sorry that I'm bringing you into this too. But because it's actually all the things that we've talked about now and what you've mentioned, Troels, correct me if I'm wrong, but that's actually something that goes for all of us. I sometimes see that people with MS, they're like the canary in the coal mines in the old times, you know what I mean? When the canary bird stopped singing, we should actually all leave the coal mine. So when we have people with MS who are getting too much pressure on themselves in their work life, maybe we should stop and think that this is something that goes along, that actually affects all of us, that we work smarter. So do you have anything to say about that, Troels?
Yeah, I think you are very much to the point. I also like your point about the technological support. On the other hand, I would like to promote the thought that while technology is here, while technology will definitely take over a lot of functions, I still believe like having the mother and the father, having the social connections, and not only meeting on the net, but meeting in real life, is very important for MS patients and for everyone else.
I have a question, Sophie. In this digital tool, will there be any kind of information that you, as a person with MS, can give to your employer or to your wife or husband, or that actually informs, if you go, I have MS, and people start going, okay, I'll text you something. Let's talk tomorrow. Read this and I'll talk tomorrow.
No, it's more a tool that can, so when the doctor tells you something and you have to go home and then you have to do it, but what was it he was saying?
You translate from doctor language to normal
exactly.
language.
But if there are like 12 months between you seeing your healthcare professional, it can be difficult to like remember what you should do and what you not should do. So a tool you like support you the time in between.
That's it. Any other ones? You want to say something about?
Could it be something to your doctor or your hospital arrange some group meetings that you are a part of, instead of going online and Google and stuff, instead of meeting other people with MS, to change experience? Because my doctor maybe have told me something that your doctors not have told you, and then you can change
what would
experience.
you, if you should give some advice or some to 3 things that we could do that could help me and everybody to improve brain health and quality of life, people with MS, Hannah?
It's really hard. but I think.
So it isn't the world versus MS anymore, but it's just the world.
Yes, exactly. I think, and also like, didn't know who said it, but you always get this advice that you need to train like this and eat like this and do like this. But maybe it's just me.
It's
but
extremely boring if you don't want to.
All these rules can sometimes.
And also, if it puts your pressure on you that if you don't do that, you will lose something.
Yes, exactly. So it should be up to me.
The
Okay.
reward?
Yes, exactly. So if maybe you said to me like, don't eat meat, and then I just happen to eat meat, and then I have maybe new lesions, and then I start to blame myself for
just one thing that you say could be a benefit for us to know about how we could help improve the quality of life and brain health for people with MS.
I think like everyone said, just see me as a human and not as a MS patient.
Yeah.
And that I am so much more.
Thank you very much. I think that's a very good position to move on, because we will take questions from if there are any questions. to the panel.
There is a question.
Yes, Finn.
One of our patients had said that what you really rehabilitate is our heart and mind. So, could you comment about connecting the whole human being with the brain? And to Troels, I wonder, I can't imagine any side effects of rehabilitation, but could there be side effects from neuroplasticity when the brain grows? Could you get headache?
Yeah, I mean, neuroplasticity is not only good. We know something like writer's cramp, where you had these old monks sitting in the churches writing the Bible their whole life. And as they wrote the 100th Bible, the letters became smaller and smaller. The muscle tension increased and increased. This is really plasticity that's overdone. So there is a reason why the brain has settled for a given level of plasticity. My point is just, if it's going to help you, then try to increase it. Be physically active, be mentally active, maybe even combine it. There's this brain-derived neurotrophic factor, BDNF, that plays an important role in connecting those two.
And get your sleep.
Get your sleep, eat healthy, all these things.
All these things that actually goes for everybody, whether you have MS or not. So, and I would like to repeat that I definitely mean it from my heart when I think that there's so much wisdom in being together with people who, in this case, have MS. On the boat during a night watch, we could switch from the deepest talks of what life is about to what's for dinner tomorrow. So we just easily go swap from that one topic to the other, so that we have a lot of things to gain from actually doing what you're saying, and you're already saying that we just see each other as persons, because we can all learn from each other as your doctor. So I'd like to, I'm going to round up, right? Yes. So, because I'd like to then not only ask the panel, but also everybody present here, what are you, each of you and together, going to do different when you leave this room to improve brain health, the way we've talked about it today, and the quality of life of people with MS and ourselves for that matter? Thank you very much for attending to this debate, and thank you very much to the panel for joining us.
Thanks.